welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look at today's top health news. Medical seats in Gujarat up from 1100 to 6000, PM Modi declares. The Prime Minister Shri Narendra Modi recently highlighted that the medical seats in Gujarat have seen a record increment from 1100 to 6000, with more than a dozen medical colleges now functioning in the state. Speaking about his native state, the Prime Minister said that a situation has reached neither can I leave Kutch nor can Kutch leave me. He talked about the recent expansion of medical infrastructure and education in Gujarat. He said today there are 9 AIIMS, more than 3 dozen medical colleges, up from 9 colleges earlier. Medical seats have increased from 1100 to 6000. He further pointed out Ayushman Bharat Digital Health Mission is expanding the facilities for all the patients. Modern and critical healthcare infrastructure has been developed through the Ayushman Health Infrastructure Mission in the district and is being taken up to the block level. Hospitals are being constructed in every district. Similarly, AIIMS are being established, medical colleges are expanding medical education, and the country is likely to get a record number of doctors in the next 10 years. Ayushman Bharat's teleconsultation facility to start at 1 lakh wellness centers from today. Teleconsultation facility e-Sanjeevani will start at 1 lakh Ayushman Bharat Health and Wellness Centers from today, the Union Health Minister Mansukh Mandaviya said on Friday. Mandaviya has chaired a virtual meeting on Tuesday with all health ministers and senior officials of all the states and union territories to review the operationalization status of Ayushman Bharat Health and Wellness Centers and teleconsultation services. COVID cases surge in Maharashtra, Delhi-NCR and Haryana. With the national capital witnessing a surge in COVID-19 cases in the last 2 days, the Delhi government has said that it is closely monitoring the situation and has stepped up the availability of medicines, hospital beds and oxygen capacity. Medical experts have asked for at least some of the COVID-19 restrictions, including masks, to be made mandatory again and have urged the government to be more generous with booster doses. The daily COVID-19 cases in Delhi have been on the rise over the last few days and the positivity rate has jumped from 0.5% to 2.7% in a week. On Friday, Delhi recorded 366 COVID cases in the last 24 hours with a positivity rate of 3.95%, the highest since February 3rd. Delhi CM Arvind Kejriwal said that there was no need to panic as hospital admissions are not increasing. Delhi Health Minister Satyendra Jain has appealed to the people to get vaccinated at the earliest. Wearing a mask while leaving the house can prevent most cases. Even though cases of COVID-19 have increased in Delhi, the number of patients who have been admitted to hospitals is still normal. Apart from this, the XE variant has not been included in the list of variants of concern by the World Health Organization, so there is no need to panic, he further added. FDA authorizes first ever breath test for diagnosing COVID-19. The first test that can detect COVID-19 virus in breath sample received emergency use authorization by the US Food and Drug Administration. The test can be performed in environments where the patient specimen is both collected and analyzed, such as doctors' offices, hospitals, and mobile testing sites, using an instrument about the size of a piece of carry-on luggage. The test is performed by a qualified, trained operator under the supervision of a healthcare provider licensed or authorized by the state law to prescribe tests and can provide results in less than 3 minutes. Today's authorization is yet another example of the rapid innovation occurring with diagnostic tests for COVID-19, explained Jeff Shoren, the MD-JD Director of the FDA's Center for Devices and Radiological Health. The FDA continues to support the development of novel COVID-19 tests with the goal of advancing technologies that can help address the current pandemic and better position for the next public health emergency. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.